Hi there again. When people used to come to me as a counsellor and working, with people who are struggling with something psychologically, it's always important to really explain to them that, my role as the counsellor or psychiatrist role or psychologist role is really about getting the person to do work. Think of if you think of counsellors and psychologists, psychiatrists, essentially their role is almost as a coach for the person, like a single sport player who has to still do the work. So as much as you might have be a great psychiatrist or a great psychologist and know lots of stuff, but ultimately if you can't get that person to do the work that's required themselves, because ultimately they do the change themselves. It's not you as a psychologist, psychiatrist. Once they leave, you've given them information, you've had your discussions. If they don't get any insight out of that sessions and do some work in between that can change whatever pattern is keeping them in the place where they are struggling, that means nothing. Nothing will happen if they don't do the work. So if you think of, a person as a tennis player, for example, the coach can tell them how to hold their racket, can kind of talk to them about technique and even try and work with the psychology side of it. But if they don't put in the miles, they don't hit the balls, they don't do those things, they won't have the skill set to improve in those aspects of their game. Mental health's no different to physical health. If you don't do things that's going to help you, then it won't help you. Nothing will change. You'll stay the same. So if you're overweight, for example, in a physical sense, and you don't, increase your exercise or do something different in terms of your food intake and all that stuff, you're not going to get a different outcome. And mental health's a bit the same. If you don't put in the work, or if you put in the wrong work, like, some people might do things to mask whatever the issue is, right? That's why I have a problem with just having medication as a way of dealing with someone's mental health state, because whatever caused it, the problem won't go away just by giving someone a mask or something that'll deaden the pain of how they're thinking, or doped up, however you want to call it. But essentially it's about making sure that you're doing the work. So when I get people to do like a thoughts diary, I'm trying to break a pattern of them using red brain and going into blue brain, which is much more productive, gives them an opportunity to think through, activate a part of the brain that's much more likely to give them a better outcome. So for me, that work needs to happen. But as much as I might give them that advice, if they don't actually do the work, they don't actually do the journal, they don't do those steps, nothing's going to change, right? They might hear it, they might, I guess, really think through, but if they don't actually put in the work, nothing's going to change. So understanding that kind of stuff, and again, using different techniques. There's lots of counselors, lots of different ways we can do this work, but it's about making sure that the person actually goes and does something about it, because, as a counselor, that is the key part. Is like, you need to be most effective when you're really getting people to change and do things more. Same as a fitness coach, if people go, they listen, they do it, but they don't do the sessions, they don't put in the miles, they don't run on the treadmill, they don't do the weights, their physical appearance won't change at all. And so same with mental health, right? You've got to understand that there's a part that you have to do personally. Well, not a part, the whole part is you actually doing stuff. Those people are there to guide you. They're like a navigator, if you like, but someone still driving the bus, and you're the driver of that bus. So you need to understand that, take on board what they're saying, do some things, and if it's not working for you, there's no reason you can't change who the counsellor is for yourself, right? Like sometimes it's also a connection. If you don't really feel that connection with that person, then look at other options, and certainly understanding that part of any psychological mental health plan is really important. Thank you.